Hello, and thank you for joining me again. Today we're going to focus our discussion on the mouth and the different structures associated with the mouth. And so let's get started. At the end of this video, my goal is for you to be able to distinguish between primary and secondary teeth, along with the different types of teeth that are found in your mouth. We're going to look at the anatomy of a tooth, and we'll talk about tonsils, function location of tonsils, and the importance of salivary glands and their role in this process we call digestion. So let's get started. Last time we talked about the alimentary canal, which begins at this structure called the mouth. So the mouth receives food and begins this process called digestion by mechanical means. And so we talk mechanical digestion, remember it's the same as mechanical weathering or physical weathering. So it's the breaking down of big particles into smaller particles. And that's done by your teeth. But there's also this chemical part. And so saliva, the reason we have saliva, what saliva does for us, saliva has these enzymes that start breaking down food. And this begins the process of softening and allowing it to be broken down and makes it easier to chew. Our mouth is known as our oral cavity. It's surrounded by your lips, your cheeks, your tongue, and your palate. So here's a picture. So your lips are on the outside, cheeks are here on either side, left and right. You have your palate at the back. So you have your hard palate, which is the bone structure you feel at the front of your mouth. Your soft palate is behind that, which is tissue. We have your tongue here as well. So those are the different boundaries to your mouth. Here's some more descriptions. So the cheeks form the lateral part of your mouth. I don't know if you need to write all this, just be aware of it. It's a thin, muscular, and fat layer. Facial expression helps move food in the mouth, is what your cheeks do. Lips surround the mouth opening. They do a couple things. One, they manipulate your food within your mouth. They are used for facial expression. They also have these sensory receptors for temperature and texture. So your lips are red due to having a large number of blood vessels near the surface, which allows them to sense for temperature and texture of food. But they have a purpose, of functional purpose to being there. The next piece we have is our tongue, which is connected to the floor of the mouth by this thing called the frenulum, which keeps your tongue anchored to the floor and prevents you from swallowing it. And then you use your tongue for things like speaking, you manipulate your food, and you taste your food with your tongue. You have these things called papillae. I think we've talked about papillae, dermal papillae in the skin. These are projections. So your tongue's got these little bumps on them, which is used to handle food in your mouth, and some have taste buds, actually. And so, side note, but tigers have these things called papillae, and the papillae on a tiger are rough enough that they can rip the paint off a wall. So if they lick a painted wall, they can rip the paint off the wall with the papillae on their tongue, which is kind of nuts. But back to people. So at the back of your tongue, we have these things called lingual tonsils. And so these serve an immune function, which we'll look at tonsils here in a second. Okay, so here's a picture of your mouth. This is your tongue with its papillae. You have a palatine tonsil off to the side. You have your lingual tonsils behind your tongue. Epiglottis is in the back. But this is our structure. So the mouth is here. The tongue is a muscle, which is this whole entire structure in the middle. Pushes food to the back. So these palatine tonsils here are found here. Your lingual tonsils are at the base of your tongue. So these ones you can't see. But we do have the palate. We have the soft palate. And cheeks are on either side, which you can't really tell here. But then your lips are in front, which keep food in your mouth. Okay, so in moving farther into the mouth, we have this thing called the palate. So you have a hard palate and a soft palate. The hard palate is the palatine bone, which we looked at when we did the skeletal system. It's that hard bone. So you feel just inside your mouth, you push up, there's a hard structure. That's your palate. That's your hard palate, which is, again, the palatine bone. Behind that, you have your soft palate. This is a muscular arch at the back of the mouth. And so that is all tissue. You put your finger back there and push. You will actually push upwards because there's no bone to stop it. So when you swallow, you pull your soft palate and the uvula downward, closing the opening between the nasal cavity and the pharynx, preventing food from backing into the nasal cavity. So this seals off your nasal cavity, which allows food to flow the right direction. Okay, and then in your mouth, you also have these things called palatine tonsils, various tonsils. The palatine ones are located on either side of the palate. And these are the ones that, they help fight infection. 2, these are the ones that you have taken out if you have tonsils removed. So these are the ones that you can see if you look inside someone's mouth. If they have them, you'll see these tonsils. We also have structures called pharyngeal tonsils, which are also known as adenoids. These are located above the soft palate between your nasal and oropharynx. So between the nasal and oropharynx, these are up in your superior region of your pharynx. There is these pharyngeal tonsils. Back to the mouth and back to digestion. We're going to talk about teeth. Teeth are the hardest structures in the body. And so you have 2 sets of teeth. And so are they part of the skeleton? Not exactly. We're going to talk about structures that form different than bones are. So we'll look at your 2 sets of teeth. One are called primary or deciduous teeth, and one are called secondary or permanent teeth. Wow, it's 2 really bad lines. So we have primary or deciduous teeth, and we have secondary or permanent teeth. Your primary are smaller than your permanent. They begin to grow somewhere between the age of 6 months and between 2 and 4 years. Okay, you'll have 20 of them. So when you're a baby, you have 20 baby teeth. You have 8 incisors, 2 upper central, 2 lower central, lateral and lower lateral. So your 4 teeth in the front, 4 teeth top, 4 teeth bottom are your incisors. Outside of that, you have 4 cuspids. So the next tooth over is called a cuspid or a canine. And then cusp just means projection. So that's where the name kind of comes from. And then behind that, you have these 8 molars. You have 4 upper and 4 lower. 2 left, 2 right, 2 top, and 2 bottom on either side. And then for your primary teeth, these are identified by letter, starting with A, the upper right portion of your mouth, and ending in the lower right portion. So you go upper right to upper left, and then you go down to the lower portion of your mouth as well. And then your second set, those are primary teeth. These are now secondary teeth or permanent teeth. You have 32 of these. As your mouth gets bigger, you hold more teeth. These guys begin to come in at roughly 6 years of age. So kindergarten-ish time, you begin to lose your baby teeth and you start to get your permanent teeth. So their presence causes the primary roots to reabsorb and fall out. So this is why your baby teeth fall out, is those nutrients get reabsorbed. And so then they can be repurposed to make your primary teeth and you grow in bigger teeth. Your third molars, these are called your wisdom teeth. These come in when you are 17, 18 years old. Some of you, I think, have that going on now. But these are called your third molars or your wisdom teeth. So your 32 teeth. You have 8 incisors. Still 2 upper, 2 lower, 4 on top, 4 on bottom. I guess 2 central upper, 2 central lower, 4 on top, 4 on bottom. Outside of that, you have, again, the 1 canine, top, bottom, left, right. So your 1 cuspid on either side, on all sides, top and bottom. Behind that, you have your bicuspids. So this is going to be 2 on the top left, 2 on the top right, 2 on the bottom left, 2 on the bottom right. And then we have, last but not least, is our molars. So first, second, and third molar. So again, if you don't have your wisdom teeth in yet, you only have 8 molars. If you have your wisdom teeth taken out, you only have 8 molars. But these are your last teeth. These are number 1 through 32, starting at the upper right, ending at the lower right. So again, you all the way around and then go back that same way to the other side. Those are your teeth. Okay, functions. Getting into a tooth specifically, your teeth have different functions. So your incisors, your front teeth are used to cut food. Your cuspids, canines, grasp and tear food. Your bicuspids and molars, they're flat, they mash the food. So each shape is corresponding to its function. And then within all of that, we have parts of each tooth individually. So there are 3 main parts. You have the crown, which is the area above the gum that you can see. It's covered by this thing called enamel, which is the outer layer. Inside of that, we have the structure called dentin. This is the living part of your tooth. It's softer than the enamel and the outer layer. This is your live layer, and it's fed by your pulp, which is your cavity. This is the connective tissue, the nerves, the blood vessels that connect to the dentin. Again, we have the crown, where the crown transitions at the gum line. So the area above the gum is the crown. The next portion is called the neck. This is the transition point, and then the root is every part of the tooth that's below the gum line. and this holds your tooth to your jaw. Okay, where your tooth actually meets your jaw, it's surrounded by this thing called cementum, which is similar to this enamel stuff that surrounds your teeth, but this sticks the tooth to the bone, which holds your teeth in place. And then you have this structure called the periodontal membrane, which surrounds the tooth and the bone both, providing a covering. Okay, so here's your picture, your diagram of a tooth. So we have the crown, which is everything above the tooth. Inside of that, you have the outer layers called the enamel. Beneath that, you see this softer looking stuff called dentin, and then within the dentin is this pulp cavity, the nutrients that come in. Where the tooth meets the gums, we have this area called the neck, and then beneath that is all the root. And so here you can see your periodontal ligament, which is the part that connects tooth to the gum. You have your cementum, which is the glue-like stuff that holds it there, and then your root canal. So if you have to have a root canal, this is what you're having done, is they're drilling into your tooth here. Okay, and so that is your tooth. Okay, back to the mouth as a whole. So again, this is just kind of a cliff notes of everything we've talked about. So your cheeks are the lateral walls of your mouth. They hold food in the mouth and help to chew. Your lips surround the mouth. They have receptors to judge characteristics such as temperature and texture. Your tongue is on the floor, which mixes your food with saliva, moves food towards the pharynx, taste receptors. The palate is the roof of the mouth, which closes off your nasal cavity and directs the food down to the pharynx. Your teeth are found in sockets of the mandibular and maxillary bones, and they break food into particles, smaller particles. They mix the food with saliva. That is the function of your teeth. Okay. Also within your mouth, we started talking about saliva, so let's kind of go back to that. You have these things called salivary glands. Their whole purpose is to, again, secrete saliva. The function of your saliva, it moistens food and begins the chemical digestion of carbs. So this has in it has amylase, which begins to break down your carbs. The pH of your saliva needs to be somewhere between 6.5 and 7.5 for these enzymes to work. If you consume pop, this will decrease your pH, making your digestion worse and actually decaying your teeth. So pop is acidic and kind of breaks down structures in your mouth and interferes with your digestive process. There are 3 types of salivary glands. One of them is called the parotid glands. So parotid glands are your largest salivary glands. They are anterior and inferior to your ears, so in front of and below your ears. There's the duct that enters through the buccinator muscle into the cheek. So these dump into the side of your cheek, the saliva, so you can digest your food. So parotid is there. What I say if you're submandibular. So here this is sub being below, mandibular referring to mandible. So these are found inside the lower surface of your jaw, near your frenulum, which is again where the tongue is attached to the floor of your mouth. The last one is your sublingual glands. Again, sub being below, lingual referring to the tongue. So this is inferior to your tongue. Are your 3 salivary glands. You will need to be able to identify and remember those terms. So here's the diagram showing you your sublingual gland is right here beneath your tongue. So your tongue is up here. That's your sublingual glands. Here you have your mandible, and within your mandible, beneath your mandible, you have your submandibular gland right here. And then this last one up here is called your parotid gland, which is anterior, inferior, in front of and below your ears. Here are some questions to kind of wrap things up for this little section. Make sure you look through these, provide an answer to them. If you have questions on those, please bring it to class when you return. And I look forward to continuing this unit and this topic of discussion with you when you return to class. Thank you very much. Enjoy the rest of your day, and I will see you next time.